Hey, Steph, good morning. Yes, we will keep an eye on that fire, that's for sure. And let's bring you some of the other stories that we're watching at this hour. We all know that we are in this third wave of COVID-19, but we also know that our health system is overwhelmed. Hospitals now across the province have been asked to ramp down when it comes to these elective and non-emergency surgeries. The Ontario Hospital Association saying this move takes effect Monday. CEO Anthony Dale sharing the information on Twitter late last night, adding a major redeployment of staff and resources is required to provide care for a large wave of COVID patients requiring hospitalization. There are currently over 1,400 people in hospital, 525 in intensive care. New modeling is predicting that we could see 800 in the ICU by the end of the month. And this comes as Ontario reporting more than 3,000 cases for the third day in a row. Meantime, doctors are sounding the alarm after seeing a sharp rise in COVID-19 cases in children.
There's no question now with these variants that are much more infectious that children are spreading it to each other. Children and youth are getting sicker and there are higher rates of hospitalization.
In the last 14 days, 537 cases have been reported in children at licensed childcare centers and homes. Just yesterday, a Montreal hospital confirming a 16-year-old becoming the youngest person to die of the virus in Quebec. Education Minister Stephen Lecce telling CityNews reporter Tina Yazdani that the province is working on getting educators vaccinated in high-risk neighborhoods in Toronto and Peel over the spring break.
Our priority is knowing how we can strengthen our protocols. We've already done that earlier this year. Our challenge continues to be supply. I'm working around the clock once vaccine arrives to get them into the arms of these workers. It is critical for their safety. We recognize that.
The province says schools will remain open during the 4-week stay-at-home order with increased testing and more safety protocol. However, some boards like Toronto and Peel have moved students online until at least April the 19th. Okay, starting today, over 100 inspectors will be checking in on warehouses, food processing plants, and manufacturers to make sure that the businesses are following the rules and the new restrictions.
Particularly going to focus on masking protocols being followed, physical distancing, capacity limits.
Starting this weekend, malls and big box stores will be the focus. Big giant retailers like Costco and Walmart, they now must block off non-essential aisles, many using ropes, tape, signage to separate items. Now, as kids begin that delayed spring break next week, the rules around what's open and closed, it's been very confusing for not just parents, a lot of people. So under the new stay-at-home orders, all indoor gatherings banned with the exception of your household. Outdoor social gatherings limited to a maximum of 5, both indoor and outdoor dining, that is banned. But golf courses, BMX and skate parks, they are open with restrictions. Tennis courts, basketball courts, parks and sports fields, they also remain open. Now, we have a full list on our website, so if any of this is confusing for you, please do head to our website, citynews.ca. Now, we are following a couple of different outbreaks here. First up in Vaughan, a nail salon. Health officials warning of this outbreak. York health officials have said that 7 staff members contracting COVID-19, at least 84 people have been classified as high-risk contacts. This happened at Nails at Anthony's on Weston Road. 7 of the 8 staff confirmed to have variant cases and were working while infected. Officials say the establishment did not maintain a proper patron list. All customers who visited this salon between March 23rd and the 26th are now being asked to self-isolate for 14 days. And we're also watching this, 13 employees at a Canada Post facility testing positive for the virus. The Crown Corporation saying it was made aware of infections at the processing plant on Eastern Avenue over the past 2 weeks. The facility is currently offering voluntary rapid COVID testing to all of their employees. Anyone who tests positive will be asked to self-isolate and will be given paid leave. So starting in a couple hours from now, 8 o'clock this morning, Toronto residents who are 50 and older living in specific COVID hotspot neighborhoods can book a vaccination appointment. So there will be mobile and pop-up clinics vaccinating people 18 and older in a lot of these high-risk communities. The eligibility change means that over 265,000 people will be able to sign up. Doses could start being administered to residents by Monday. The city also opening its final 3 mass vaccination clinics on Monday. Residents who are 50 and up in Peel region can also book a vaccine appointment starting today. Let's bring you now to a live look at Masjid Jerusalem. This is a local mosque in Thorncliffe Park. This place of worship, just one of many community organizations being used as a pop-up vaccination site. And if you want to take a closer look at those postal codes of these 50 hotspots across the GTA, specifically in Toronto, again, I encourage you to go to our website, citynews.ca. Well, many people who are already vaccinated may feel that they are protected against the virus, but federal officials say there is still little data when it comes to the long-term effectiveness of this shot.
Let's say you have a vaccine, 2 doses, you have a 90% effectiveness. I think on an individual level, that's great. You can go around, wow, I'm protected. But unfortunately, there would be people that, even though they're vaccinated and thinking that they're protected, actually the vaccine wouldn't work for them and they would still be susceptible to, getting COVID-19 and then, if they got it, getting sick and transmitting to others.
Health officials say if Canada can reach 60 to 80% herd immunity, that would be enough to control the overall pandemic, adding that there should be enough vaccines to give a first dose to every adult who wants one by July. And coming up here in about an hour's time, just after 7 o'clock, we're going to be talking about vaccines as well as these long-term COVID health implications and complications with a health expert. Right now, your time is 6:10, and with more Canadians building home offices during COVID, we got a lot of renos coming up, and something else is on the rise. We're going to explain coming up this new pandemic trend when it comes to renos. Mike Eppel breaking down those numbers.